Cabinet met this morning to assess the up-to-date COVID situation, which I must say at the outset is extremely serious, and to discuss what further action is necessary to minimise further spread of the virus. I will set out the decisions we reached shortly. However, I can confirm now in summary that we have decided to introduce from midnight tonight for the duration of January a legal requirement to stay at home except for essential purposes. This is similar to the lockdown of March last year. However, before I set out these decisions in more detail, I want to take the opportunity to explain in some detail why they are so necessary. In the past few weeks, there have been two significant game changers in our fight against this virus. One, the approval of vaccines, is hugely positive, and it does offer us the way out of this pandemic. But the other, the new faster spreading variant of the virus, is a massive blow. And possibly the most simple way of explaining the challenge we face right now is to compare it to a race. In one lane we have vaccines, and our job is to make sure they can run as fast as possible. And that's why the government will be doing everything we can to vaccinate people as quickly as possible, and I will say more about that later. But in the other lane is the virus, which, as a result of this new variant, has just learned to run much faster and has most definitely picked up pace in the past couple of weeks. To ensure that the vaccine wins this race, it is essential to speed up vaccination as far as possible, but to give it the time it needs to get ahead, we must also slow the virus down. And because it is now spreading faster, that means even tougher restrictions are necessary. The evidence, Presiding Officer, is now compelling that the new variant is up to 70% more transmissible than previously circulating strains, and that it may add as much as 0.7 to the R number. And according to recent analysis of PCR test samples, it appears that the new variant already accounts for almost half of all new cases. And faster spread is undoubtedly driving the very serious situation we now face. Today's case numbers, 1,905 new cases, with 15% of tests being positive, illustrate the severity and the urgency of the situation. No new deaths were reported today, but that is because yesterday was a Sunday and registration offices were largely closed. But since I updated Parliament before Christmas, 289 deaths have been recorded in our daily figures. That again reminds us of the continuing grief that this pandemic is causing. But let me stress, this is not just about one single day's numbers. We are now seeing a steeply rising trend of infections. Indeed, it is no exaggeration to say that I am more concerned about the situation we face now than I have been at any time since March last year. In the week from the 23rd to the 30th of December, the 7-day incidence of cases per 100,000 of the population increased by 65%, from 136 per 100,000 to 225 per 100,000. Test positivity has risen sharply too. The next update on the numbers of COVID patients in hospital and intensive care will be published tomorrow. I would expect these to show that nationally, the total number of COVID patients in hospital is now close to the April peak. And in some wards, the pressure is already very real. For example, in terms of hospital beds, NHS Ayrshire and Arran is currently at 96% of its COVID capacity, and three other health boards, Borders, Greater Glasgow and Clyde and Lanarkshire, are above 60% of their capacity. The number of people in intensive care is still significantly lower than the April peak, which of course partly reflects the fact that treatment of COVID has improved significantly since last spring. But even so, the total number of patients in intensive care in Scotland is already above normal winter levels. Indeed, all mainland health boards have now exceeded their normal intensive care unit capacity. And it is important to be clear, and this is a key point, that people who are in hospital and intensive care now are likely to have been infected 10 days to 2 weeks ago. That means that these numbers reflect what the level of new cases was around 2 weeks ago. And given that the number of cases has increased significantly since then, that means we can expect to see significantly increased pressure on the NHS over the course of this month. Now, contingency plans remain in place to double and then treble ICU capacity if necessary, and the NHS Louisa Jordan continues to be available to help meet demand, as indeed it has been doing in recent months. 12,000 patients have attended there for scans and outpatient appointments. Nearly 5,000 NHS staff and students have been trained there, and it is currently being used for COVID vaccinations. In short, NHS services are coping at present, although the pressure on frontline staff is considerable. But already in some areas the position is fragile and it is getting more challenging. And if the rate of increase in case numbers that we have seen in the past 2 weeks was to continue unchecked, there would be a real risk of our NHS being overwhelmed, even with contingency plans in place. In fact, our modelling suggests that without further intervention, we could breach inpatient COVID capacity within 3 or 4 weeks.